Multiple sclerosis. Hi everyone, me and my group partners, Melissa, Aska, and Grunika, and myself, Jazz, are going to be presenting multiple sclerosis today.
So, firstly, we are going to talk about what multiple sclerosis is. Multiple sclerosis is an autoimmune degenerative disease that directly affects the central nervous system, including the brain and spinal cord. It is a chronic neurodegenerative condition where the immune system of the person affected results in the demyelination of the neurons. As in the picture, you can see the difference between a healthy neuron and the neuron of a person affected with MS. The demyelination of the neuron results in neurological signs and symptoms that can occur over time as the disease progresses. MS can damage the white matter in the cerebral hemisphere, cerebellum, brainstem, and spinal cord. Now, depending on the symptoms and the severity of the disease, it can be divided into four types. The types are clinically isolated syndrome, relapsing remitting multiple sclerosis, primary progressive multiple sclerosis, or secondary progressive multiple sclerosis.
Barriers to care. People with MS suffer from continuous muscle atrophy, which makes it difficult for them to access care. Depending on the severity of the disease, most people with MS need assistance to walk, and worsening of the disease can result in wheelchair use. They often have visual disturbances and cognitive impairment. For this group, structural barriers such as lack of suitable parking, access, and toilet facilities become more apparent as level of disability is increased. Physical exertion and warm climate are believed to worsen the symptoms and are a barrier to care for these people. Medical challenges. MS challenges can be divided into three groups: primary, secondary, and tertiary. Primary symptoms, which consists of sensory disturbances, walking difficulties, vision problems, cognitive impairment, and sensory disturbances such as numbness, tingling, itching, and burning. Secondary symptoms, which are complications that may arise as a result of primary symptoms, such as bed sores due to paralysis, repeated urinary tract infections due to bladder complications, decrease in bone density, and breathing issues as a result of inactivity. Tertiary symptoms, which are referring to the social and physiological issues as a result of the burden of living with this disease. They include losing his or her livelihood due to the inability to perform normal day-to-day tasks. Depression can be brought on by a direct damage occurring within the central nervous system or the strain of living with a chronic illness and its unpredictability and uncertainty, which can be bothersome. Some dental challenges. Clinical symptoms of MS include motor dysfunction, such as weakness, stiffness, lack of coordination, vision deficiencies, which is due from inflammation of the optic nerve, and bulbar systems, such as dysphagia, difficulty articulating, weak jaw, and facial muscles, including cognitive dysfunctions and mental disturbances, which may interfere with oral hygiene. Patients have also described a lack of knowledge of MS symptoms, medications, and how they affect the oral health and dental care. The biggest risk factor of dental disease are challenges in motor coordination for poor oral hygiene and difficulties with access to care.
Right, so some oral manifestations of multiple sclerosis are chronic fatigue and depression, which may result in a lack of motivation and could exacerbate dental disease. Medications causing xerostomia can also bring on oral diseases and halitosis. Immunosuppression causing a risk for periodontal disease at accelerated rates, candida infections, human papillomavirus, and leukoplegia. Decreased orofacial muscle function in the temporomandibular joint, the tongue and facial muscles, which can cause scanning speech, which is like a slowing, irregular speech. Muscle spasms and tremors may also exacerbate oral diseases and trigeminal neuralgia. So trigeminal neuralgia, 4 out of 6 out of 100 people who have MS have trigeminal neuralgia, making them 400 times more likely to have it when compared to the rest of the population. So the pain is an electric shock, very sharp, aching or burning feeling. It can occur unilaterally or bilaterally. It occurs where the trigeminal nerve innervates around the eyes, ears, forehead, and inside the oral cavity. Pain can be brought on by anything as little as a breeze, talking, drinking, head movements, smiling, chewing, and swallowing.
Remitting MS.
When we met, Jennifer was in a wheelchair. She had progressive MS. I was relapsing remitting, and some 15 years later, I've never known Jennifer to walk. So people don't know what it really means to have a progressive form of the disease. It's the core of everything that we do, everything that we deal with, everything we live with as far as our day-to-day activities. That's just part of who we are.
There are days when I really just want to use my hands. I want to put on makeup. I want to fix my hair. And dang it, I can't do it. And I am very lucky Dan is there to support me and to help me.
So in this video, it highlights that regardless of the challenges that someone with MS might face, they still want to be treated like a person. They want to live a happy, healthy life. They want to do the things that make them feel positive and make them feel fulfilled. It shows the many faces of an MS diagnosis and how it isn't the end to living a beautiful life. So some adaptations to daily life. It's absolutely imperative that someone with an MS diagnosis takes extra time in their day to focus on their well-being. And doing this may include implementing an exercise or stretching regimens to improve muscle function and decrease spasticity in the muscles. Implementing and ensuring that a sufficient sleep schedule is made. Making healthy nutritional choices and limiting alcohol consumption, ceasing tobacco consumption if they do smoke or drink. And by giving support and sharing knowledge and resources, a client with MS can change the impact that MS may pose on their oral health. So some adaptations to oral health care would be to provide them with a tobacco cessation program if the client smokes cigarettes, or support the client in limiting or ceasing alcohol consumption if they do drink as well. Support them with knowledge and resources to make healthy nutritional decisions. Work with them to find out what devices might work better for them. So if they use an electric toothbrush, or maybe bending a manual one, using different types of interdental aids, whether if they are unable to use certain ones, and using a larger ergonomic toothbrush handle may help with the oral hygiene regimen.
Here are some dental solutions and treatment planning options you can try with your MS patient. Shorter appointments in the morning. Comfortable, quiet, relaxed environments can reduce stress. Washroom breaks for bladder or bowel incontinence. Adaptation to ambulation problems, muscle weakness, tremors, and visual disturbances. Prevention of disease exacerbation by making frequent dental hygiene appointments. Advanced MS clients will require assistance transferring onto the dental chair.
So the role of the dental hygienist are being a clinician, being an educator, being an advocator, and being an administrator.
The role of the dental hygienist as a clinician can be to apply the process of care and gain understanding in how to treat individuals with MS to not be a barrier themselves. Thorough assessment of the needs of individual, making accommodations, tailoring care specific to their needs, for example, chair adjustment, removing operatory barriers, and booking them shorter appointments, allowing the person to feel comfortable and confident in receiving care. Their role as an educator could be thorough assessment of their medical history and ask relevant questions to better understand the strengths and limitations of the client with MS, provide education in the way that is suitable for the client or the caregiver, that they understand all that education properly, provide solutions to the client's human need deficits, that is, suggesting a powered toothbrush instead of a manual, demonstrating flossing technique to the caregiver or to the client herself. The role of the dental hygienist as an advocate or an administrator could open the doors to reach and collaborate with other groups and corporations who can assist in having their needs met, that is, funding and supplies. Hygienists see first-hand the limitations and needs of their clients and are able to directly contact local representatives for the support and the administration of the programs. For example, a letter could be formulated outlining the relevance and the importance of the issues observed, raising awareness of the importance of having access to care and providing solutions by sharing their professional insights and experiences. Here is a list of references that we used to prepare this presentation for you guys. Thank you for listening.